Hip replacement surgery is an operation done for hip arthritis for a definitive that as a definitive treatment for the pain relief. The hip joint is a ball and a socket joint, ball and socket. When the joint become arthritic, the articular surface or the cartilage on both the sides gets eroded, and the patient develops severe pain in the groin and around the hip. The whole idea to do the operation is basically to give patient a pain-free hip, which will improve their quality of life, and they will be walking around better without getting any pain relief. The hip replacement surgery is usually done under spinal or general anesthetic. So what essentially it involves is you will come to the hospital on the day of the operation. You will be admitted onto the ward. Later on in operation theater under anesthetics, we do the procedure. The anesthetist will discuss the anesthetic options with you, spinal, epidural, or general, and discuss whichever is the best for you. The operation involves opening the hip joint from different positions. You can open it posteriorly. There are different options available. The commonest one is the opening the hip from the back. You open the hip, split the muscle, take the arthritic hip out, clean the area, and put a new hip. Close the wound and put the clips in, which needs to come out in 2 weeks' time. Usually the patient is up and about the following day or even the same days of the operation later on in the evening. Most of the patients needs a couple of nights stay. Many patients who are younger, fit and healthy require only 1 night stay. The clips are taken out in 2 weeks time, as I said. Patient do need blood thinning tablets for about 4 to 5 weeks time, TED stockings to prevent them having any blood clots. And as I said, the usual full recovery period is around 6 weeks. Having said that, it varies from patient to patient. The younger, fitter, healthier patient, their recovery is much quicker. And in some of the places in the world, they have started doing hip replacement surgery in a fit young patient as a day case as well. The average age for the hip replacement depend upon multiple factors. One of the factor is the patient's age itself, and the other factor is the type of the implant or bearing surfaces used. The reason I mentioned about the patient's age is if it's a young patient, he will be cycling the implant much more, he will be walking around much more active, much more mobile, and the implant will wear out off early comparing to someone who is quite elderly with the lesser mobility. When I discussed about the bearing surface, that's essentially the type of femoral head which we'll be using. The one with the best wear properties is the ceramic head, which we use. That is better than the metal head in terms of the longevity of the implant. So the average age is somewhere around 15 to 25 years. Having said that, during my fellowship in Wrightington, I saw a patient whose hip replacement was done by Sir John Charley himself about 38 years ago, and she was still walking around much better. The whole idea to do a hip replacement surgery is pain relief. But having said that, if a patient has got a dual pathology, which means if the patient has got a bad back and a bad hip as well, and you replace the hip, patient symptoms which were coming from the hip arthritis will settle, obviously, but the pain which is coming from or which is radiating or shooting from the back usually doesn't settle. So the patient should be fully aware that the hip replacement surgery is done for the pain relief, and they do get very good pain relief after the surgery. Some patients are really happy and they won't require any painkillers by the 6 weeks time frame. Having said that, as I mentioned earlier, very small percentage of patient will be experiencing some pain, which will be a referred or radiating pain from their spine. So yes, hip replacement surgery um, is one of those procedure which is gives you a very good pain relief. And if you do the literature search, one of the most high indexed journal, The Lancet, has named hip replacement surgery as the operation of the century. Yes, there are different types of hip replacement. The commonest one which is being used is the cemented. Having said that, there are uncemented versions as well. There are hybrid, there are reverse hybrid, and there used to be hip resurfacing, which was common at one time, but because of the certain reasons, that is not a popular hip replacement anymore. So the reason we do a cemented hip replacement in elderly patient or 70+ patient is because their bones are more osteopenic or osteoporotic, and a cemented implants gives them a better result and a better outcome. For a younger patient, their bone quality is usually good, and you offer them an uncemented total hip replacement, which equally has got very good results as well. Then there are other options, hybrid hip replacement, where half the hip is cemented, half is uncemented. Then there is a reverse hybrid, where you change again, do the half hip cemented and half uncemented, but it's the other way around. You do the cup cemented and leave the stem uncemented. So these were the types of hip replacement. Then, as I mentioned earlier, there are different bearing surfaces as well. When we talk about bearing surface, that is, in simple words, what articulates with what. Usually the recommendations are for younger patient, you do a ceramic head because of its better longevity. Again, the head size have got different types of sizes, and it's again, it depends on the patient's body habitus. One size does not fit everyone.